All right, welcome back and thank you for keeping it TV 47 and here on Body Garage with Sheila Chelangat as we delve into the respiratory illnesses, especially in children. And Daktari, before the break, we have, clarified the difference between, asthma and the relation with the upper and lower tract respiratory illnesses. And for the lower respiratory illnesses, are they contagious?
Are they contagious? So, just to answer that question, yes, how they are spread is through what I have called droplet infections, or sometimes even close contact. So any contact that is around within a meter, and even some more in some instances, can cause these infections.
Yes.
Okay, so as long as the individual is exposed to these infections for a certain duration of time, and through such contact with such objects, then they can get the infection. Yeah, and this spreads across all of them, the upper as well as the lower. And including other diseases that probably we have not mentioned, like TB. COVID is also a viral infection, and you remember how judging from the mechanisms that were put in place to prevent it, then it should go without say that close contact
is not good.
Yes, exactly.
Okay.
Yes. Yeah.
All right. For pneumonia, what happens if it is left untreated, especially in a child? So,
good question. If pneumonia is left untreated in a child, as I said, it can complicate, so much so that, it can affect not only the lung itself, but the bacteria can also get its way into the bloodstream and even go into the brain and even cause, what we call abscesses. It's the same bacteria that can also cause an infection of the heart that we call endocarditis. The abscesses that I talked about, the fluid that can collect inside the lung, that then can, lower the immunity much further and invite other infections.
Yes.
Yeah, so that.
Okay. All right. And moving away from now pneumonia, how it can actually, get worse. I'm wondering now, what is the treatment of pneumonia looking like? Is it just antibiotics too?
Good. Good question. So when we make a diagnosis of pneumonia, first of all, besides just treating the infection itself, in terms of treatment in the hospital, we divide our treatment into something we call definitive care and supportive care. So supportive care is focused on making the patient comfortable, even as much as we try to treat the disease itself. So supportive care will include things like fluids if the child is unable to eat orally, oxygen, because what happens is now their work of breathing is increased. And this is because of now the mucus plugs that are formed inside the lungs. And so, we breathe in air to try and get oxygen into the blood, and oxygen is the one that is critical in almost all functions of our body. So if the body is not getting enough oxygen, then it doesn't work well. And that's why you get weak. You can't, walk, like, for example, a child who is lethargic. And so it increases, it demands more. So what now that message is sent back, and the muscles are told, you need to work harder, we need to get more oxygen. So that's why we give you oxygen, to try and supplement that difficulty that is encountered because of the disease. And then now pain medication, fever medication, all that is supportive care. We may do a bit of chest physiotherapy if, the chest is so severely congested. And then definitive care now is what will, treat the infection itself. And that's where we talk about now our antimicrobials like the antibiotics, just what drug is specific to the disease. If it's TB, it's anti-TBs. If it's asthma, then we will give specific medication for that. Yeah.
And for all the illnesses that you've mentioned, starting from the upper to the lower, how long do these, illnesses last?
Yeah.
If you could give a range.
If I could give a range, so if we start from upper, and which I told you majority are viral infections, they will take anywhere from 7 to 10 to even 14 days. Some symptoms may linger even longer, like the cough may linger even for 3 weeks sometimes. But of course the child is not, sickly, even as they cough. It's just that there will be a cough here and there. For bacterial infections, we don't give it a duration per se, because ideally they're not supposed to last. When we are supposed to identify early and treat.
Yes.
And then for things like TB, any child who has had coughing for more than 2 weeks, is losing weight, is having a lot of fever and night sweats, that's a child that may require to be investigated for TB. So that can also, the cough for that and other associated symptoms can last long. Yeah.
Now, let's talk about caring after they've gotten treatment from the doctors. Let's start with a child with common cold. Would now that force me to tell my child, stay at home so that I can manage this particular infection? How do I care for a child who has, these illnesses?
Yeah. What I say is rest is essential. Even when you have a flu, I'm sure you ask your boss to give you a break. So even children, they have, common colds, if you can give them a break from school.
Yes.
Day 2, day 3 are usually the worst days, that's what I say. So for that period when they are acutely ill, you want to keep them away from other children, because obviously the spread is through contact and droplets infections. So you want to keep them away from school for a period of maybe 5 days. That's the incubation period, is a period through which the spread can occur.
Yes.
But once the illness starts and it's like 4 days, 5 days in, the child is getting better, then there's no cause of alarm. They can go to school.
They can go to school.
They can go to school.
Are there foods that a child should should avoid when having these infections?
Are there foods?
Because normally I hear, sugary foods are not good for the cold.
Yeah.
Is that true first?
So that's it's sometimes, myths have some truth around them. I don't completely discredit them, because the people who formed them, they had their reasons behind them. But scientifically, cold foods do not cause like tonsils or pharyngitis. They do not cause that. But in a child whose throat is already inflamed, irritated, he's coughing, adding sugar onto that may worsen the irritation. So I think this person who said this for the first time had a point. Yeah. Alikuwa na point. So haimaanishi you take them away completely because they will give you tonsils. No, they will not give you tonsils. But in that time that the child is ill, it may probably aggravate the symptoms. But yeah. Other foods that may influence the course of disease, I think, eating vitamins, like vitamin C rich foods, have been shown to reduce these illnesses. Yeah.
Okay. Now, you mentioned sore throats, and it can be really a discomforting, infection for a child. Are there remedies at home that a parent can take so that this child at least can eat better, can feel better? even away from, you know, the medicines from hospital.
Yeah. Yeah, so the remedies, the home remedy is sort of, we call it dawa,
Yes.
the concoction that we make. And how you make dawa, it's pretty easy. You just take a teaspoon of honey, take a teaspoon of ginger. You can do the ground ginger, a teaspoon of turmeric as well, and lemon juice. And then you can blend it, or you make, you know, the concoction.
Yes.
And then just give a teaspoon every 8 or 12 hours. That will reduce, it helps soothe the throat. As I told you, it's also an anti-inflammatory, it's an antibiotic. It's an amazing thing.
Yeah. Now, for maybe my child who has not yet contracted any of these illnesses, is there a way that I can prevent it from happening? What are some of those tips that I should take as a parent and, you know, help my child so that they do not contract some of these infections and illnesses?
Good question. Hand washing, hand washing, hand washing.
Muhimu.
Very, very important. Key in preventing respiratory illnesses. And then it has actually been shown to prevent more respiratory illnesses than it would prevent diarrhea. Because you would think hand washing, we wash our hands to prevent diarrhea, but it has been shown to prevent more respiratory illnesses than it would diarrhea. Cough hygiene, sort of teach your children how to cough. Teach them to cough into the elbow and not into the hands, because the hands are likely to touch somebody else, even if they forget to wash their hands after, you know, coughing. So again, after like coughing, bouts of coughing, sneezing, let them wash their hands as regularly as possible. We talked about breastfeeding for the very younger ones. Is very protective. The longer you do it, the better. The current recommendation is up to 2 years.
Yes. 2 years is a long time, Doc.
I know. But it will save you a lot of hospital visits. Yeah. Yeah, so breastfeeding, there's hand washing, there's you know, cough hygiene, vaccination. Yes.
How's that? So
vaccines these are actually ranked highest at prevention of respiratory illnesses, especially pneumonia. So we give vaccines to prevent respiratory infections starting from actually birth, because at birth we give TB vaccine.
Yes.
And then around 6 weeks we start now the course of pneumonia vaccine. We give a vaccine that also prevents a disease called pertussis, and this is sort of affects the very younger babies a lot. We also have a vaccine for influenza that is given around 6 months. Yeah, so we have vaccines that help prevent these infections.
But your biggest tip and pro tip to parents is to teach their children to normalize hand washing.
Let them normalize hand washing. Yes.
All right. Daktari, asante sana for taking us through this particular episode as we learned how to even prevent some of these respiratory illnesses in our children.
Karibu, Sheila. Thanks for having me.
It was a pleasure. And thank you for keeping it TV 47. We have come to the end of this particular episode. I hope that you have learned and grasped as much as you can. Thank you for keeping it Body Garage. And of course, thank you for always viewing and coming back each and every Thursday. From me, it is good night and goodbye.